Hi everyone. Today we'll see about the case history of one old female who was 70 years old and he has severe headache, and this headache was sudden in onset in nature and dull, lacking in character, and no history of trauma, vomiting, photophobia, neck stiffness, rashes, visual symptoms, and alcoholic intoxications, and no blurring of vision, and no chest pain or heaviness, and no shortness of breath, and no history of heart disease, stroke, or chronic kidney disease, and the past history which includes COPD for 4 years, and no other chronic illness, and no surgical procedures has been performed, and now not under any medications, and no significant family history also. So the risk factors suggesting serious illness is age, smoking, alcohol, and salt intake. So obesity, his BMI was 24, and history of trauma and fever, rash, stiff neck, worst headache of my life, and known status of HIV, immunosuppression, and focal neurological deficits, and diabetic mellitus. So these are the risk factors which suggest that illness. And examination, so they measure blood pressure, and which is 160 bar 110 mmHg in the right and 130 bar 90 in the left, and pulse is 90 beats per minute and regular, and it is normal value character. An arterial wall condition with no radial or radiofemoral delay, and oxygen, saturated oxygen is 93% in room air. And coming to respiratory examination, so no visible deformity, scar, or any marks or dilated veins. And palpitation, no tenderness, abnormal mass, and trachea position is also normal. And the cardiovascular examination, no rise JVP and apical impulse normal, or the swelling of extremities. When central nervous system has been examined, it is well oriented to time, place, and person, and the cranial nerves were grossly intact, and sensory and motor examination was also normal, and reflexes were also normal, and no signs of meningeal irritation, and no signs suggesting the cerebral lesions. So coming to the gastrointestinal tract examination, so it includes the abdomen, pancreas, bile, etc. So when inspected, it indicates the normal shape of abdomen and all quadrants moving equal with respiration, and no dilated veins, scars, marks, or any pigmentation or visible peristaltis, and no any abnormal mass also, and no local rise in temperature, and each quadrant is tympanic, and normal bowel sounds we examined. So diagnosis, it was suggested to diagnose with essential hypertension, hypertensive urgency, subdural hematoma, subarachnoid hemorrhage, and hyperthyroidism. So hyperthyroidism, they are used to take the test of TSH, that is thyroid stimulating hormone, and T3 and T4. So they varies with the normal range. And investigations, so complete blood count was taken, and the random blood sugar was also taken, which is 106 mg per deciliter, which is normal. And the kidney function test, it measures the amount of urea and creatinine percentage, and electrocardiogram was also seen for the sinus rhythm purpose. So management, tablet nifedipine 10 mg was given, and daily blood pressure monitor and charting at local pharmacy is advised for follow-up after a week in outpatient. And it was suggested to intake the salt reduction, that is salt intake reduction. So for adults, WHO recommends less than 5 gram of salt per day, which is under the teaspoon. And not adding salt during the preparation of food is also actions taken. And not having a salt shaker on the table, and it has to limit the consumption of salty snacks also, and choose the products with lower sodium or salt content. Thank you.